Okay, so next up we have the Station 3 portion of the Sports PPE, which includes the Musculoskeletal and Marfan check exams. So let's look at an overview of this station. As you'll notice there on the right hand side, we have a pretty large red box highlighting all of the different exams that we need to do in the station. Now, it looks like a lot, but the good thing about this station is that we can actually assess multiple student athletes at the same time if we work as a team with our fellow PA students. And we can show you how to do that later on in this presentation. So the different things we'll want to look at is the Marfan's stigmata, so we're looking for things like arachnodactyly, pectus excavatum, joint hypermobility, and plus or minus scoliosis. These things will also be assessing kind of throughout the other stations. We'll tell you what specifically we're looking for in this station. And we're also doing a comprehensive MSK exam. So that includes the neck, the back, the upper limbs, and the lower limbs. All right, so how do we prepare for this? Well, we're going to have several student athletes in the same area. We want to make sure we have plenty of space to accommodate them, and we want to review one-on-one, not as a whole, any injuries, surgeries, or components from the patient history that are important. We'll also want to ensure that they're in a comfortable position, and we'll explain or demonstrate each portion of this exam. We also want to mention that we usually work in teams for this station, so we can have 4, 5, even 6 student athletes at the same time, with several PA students responsible for watching the exam of the different student athletes and another PA student demonstrating the movements. So first up, we have the neck examination. Now, we've already kind of looked at the throat, which included some of the neck, but this is specifically the examination of the neck, meaning the mobile neck. So we're going to look for any deformities, abnormal posture, signs of injury. As you've noticed so far, the first component of most of our physical exams is inspection. We always look at the patient with their eyes first. We then ask the patient to do some gentle active range of motion. We're going to do the 4 different areas, so flexion, extension, rotation, and lateral bending. And then we also, if we find any abnormalities, we can take the time to palpate for any tenderness or muscle spasms in the region. Let's take a look at what this exam looks like.
Welcome to the Musculoskeletal and Marfan check station. In this demonstration, we'll review how to assess the neck. This is an important part of the musculoskeletal examination in the sports pre-participation physical exam. Hi Eric, I'm Christina and I'll be the PA taking care of you today, okay? We'll be doing a neck exam on this demonstration. So first, I'm going to inspect the neck for any visible deformities, abnormal posture. I'm going to look for any swelling or abnormalities. So I'm just looking at the neck from the front and from the back. Great. Next, we're going to assess the range of motion. It's going to be active range of motion. I'm going to ask the patient to follow my instructions. So do what I do, okay? I'm going to have you say yes. So chin down to the bottom, chin all the way back to the back. Good. Now I want you to touch your ear to your shoulder and then the other way. Good. And then I want you to say no by turning your head from side to side as far as you can. Great. Side to side. Great. So we just did range of motion, and for him, he has smooth and full range of motion in all directions without any limitations or discomfort. Good job. All right, now we're going to palpate the neck just briefly. So I'm just going to find the bony prominence here in the back. If I can have you turn around here, we can show them. So we're going to see these bony prominence here in the back. We're just going to palpate. We're going to ask, do you have any tenderness when I palpate here? Any tenderness on the side here? No. Great. And so that's pretty much all we need to do for palpation's sake. And that concludes the neck exam. So from here, we observed, we asked the patient if he had any discomfort, and we watched his range of motion. Thank you for watching this demonstration, and next section we'll be covering the back examination. Stay tuned.
All right, next up is the back examination. With this one, again, we want to start with inspection. The inspection is crucial on a back exam. You want to make sure that the shoulder height is equal on both sides, that there's no abnormal curvature of the spine. It's also a good idea to ask the patient, have you ever been diagnosed with scoliosis, kyphosis, or lordosis? We also want to take a look at when they are in the bent position. So we want to look at the active range of motion. We'll have the patient put their feet together and bend down to try to touch their toes. This is called flexion. We'll then assess their spine, look for symmetry of the shoulder height, and look for any abnormal curvature. Then we'll take them through the other range of motions, which are side to side, lateral bending, and twisting, as well as extension. And again, if we notice any abnormalities, we can palpate at that time. Let's take a look at the back demonstration.
Welcome back to the MSK and Marfan's check station. In this demonstration, we'll review how to assess the back. It's an important part of the MSK examination and the sports pre-participation physical exam. First, we're going to inspect the back for any abnormalities or abnormal posture. We're going to look for any visible deformities, asymmetry, or abnormal curvature. So I'm going to have you turn around this way, and I'm just going to inspect the back. I'm looking at the level of the shoulders to make sure that they are level on both sides, and usually the best angle to get is directly in front. So we're looking at that. We're also kind of looking at the spine, making sure that there's no abnormalities there. So I'm going to ask you to now put your hands together like you're diving into a pool and bend straight down to touch your toes as far down as you can. Now with this assessment, I'm looking for the level of the shoulder height to make sure it's symmetrical on both sides. If you could stay still for me, buddy. And then I'm looking at the spine to make sure it's nice and straight here. All right, great, stand up. That also checked for flexion of the back, okay? Now we're gonna do some of the other range of motions. We're gonna do side to side, so like you're picking up a suitcase on the side here. Good, now the other side. Good, great, and now you're gonna twist. Twist to the right, twist to the left. Excellent. Can you go back a little bit like you're falling backwards? Good, that's extension of the back. Great. During this process, I usually like to palpate the back. I'm checking midline for any bony tenderness, and then also on the sides for any paraspinal muscle tenderness here or spasming. Everything looked normal on Eric's exam. So this concludes the back exam. Observe, ask the patient to move through these range of motions and palpate for any abnormalities. Thanks for watching this demo, and in the next section we'll cover the upper extremity exam. Stay tuned.
All right, the upper limb, essentially we would assess all at once, but we'll go ahead for the purposes of this demonstration is take it one area at a time, because that's how we will have to document it. The first section on your sports PPE UAL form is going to be the shoulder/arm exam. So again, we only start with inspection. We're looking for symmetry on both sides. We're going to have them go through active range of motion, and we'll show you those different movements later on in the demonstration. If we find any abnormalities or they have any history, we'll want to do strength testing, and we'll also want to palpate if they are reporting any type of pain or discomfort. So let's look at the shoulder exam.
Welcome back to the MSK and Marfan check station. In this demo, we'll review how to assess the first section of the upper limb, including the shoulder and the arm exam. This is an important part of the MSK exam and the sports pre-participation physical. All right, first we're going to start by inspecting the shoulders. I usually like to inspect them both at the same time. I'm looking for any visible deformities, and I'm also looking at the upper arm area, okay? Looking for symmetry and any signs of muscle wasting, okay? Next, I'm going to assess the active range of motion of his shoulders. I'll usually do them at the same time, and I'll have him follow my movements. So you'll go ahead and go all the way up for flexion, all the way back for extension. We're going to go all the way out for abduction. Great, okay. Back to the midline, crossover for adduction. Then we're going to do external rotation, good, and internal rotation, very good. So those are all the range of motions. He did them very well. I don't see any abnormalities in right versus left. Everything is smooth and in all directions, no limitations and no discomfort. Now we're going to test the strength of the shoulders. So what I like to do with this one is both at the same time, push out towards my hands, good, push back, good, push forward, good. Now on this part, I want you to come out like this, push down, good, and push back, this way, good. Other arm, up like this. So push down, good, push back, good. So that checked all the strength of the different range of motions. And the last thing you do is kind of generally palpate. I usually palpate the whole arm at the same time, but in this case we're sticking to the shoulder and the upper arm, so that's where I would palpate any tenderness, anything like that. Okay, great. So that concludes the shoulder and arm exam. You're going to observe the patient, move through the range of motion, test the muscle strength, and then palpate for any abnormalities. Thanks for watching this demo, and in the next section, we'll cover the elbow and forearm exams. Stay tuned.
Moving on, we have the elbow and forearm exam. So again, starting with inspection, looking for any deformities, looking at the active range of motion, and if necessary, doing strength testing in that area, as well as palpation. Now let's take a look at a demo.
All right, welcome back to the MSK Marfan Check Station. In this demo, we'll review how to assess the elbow and the forearm. Okay, this is an important part of the upper limb MSK exam for the sports pre-participation physical. All right, first we're going to inspect. We always start with inspection. We're going to look at the elbows. It's a good opportunity to ask the patient if they've ever had any injuries to their upper limb, right? Once we do that, we're looking for any deformities, swelling, abnormalities, and we're comparing the right to the left elbow. Next, we're going to assess the range of motion. So again, you're going to follow my movements. For the range of motion of the elbow, we're going to go up for flexion, down for extension, and then at neutral position, we're going to do pronation and supination. Very good. Had good range of motion. That's testing here at the elbow and the forearm. Everything was smooth, full range of motion in all directions, no limitations, and no discomfort. Now we're going to test the strength of the elbow. We're basically, testing that. So I want to hold them at a neutral position. You're going to place your hands here on top, and you're going to have them try to push up. Good. And then push back down. Good. And then on this one, I try to have the patient grab me, kind of like they're shaking their hand, and turn in. Good. Turn out. Good. Same thing here. Grab my hand, turn in, like you're turning a doorknob. Good. And now turn out. Good. Good. That's the strength of the forearm for both flexion, extension, pronation, and supination. During that exam, we kind of palpated, so you want to kind of palpate for any abnormality or discomfort. And that essentially concludes the elbow and forearm exam. Remember, we observed the patient, we moved them through some range of motion, we tested their strength, and then we palpated for any abnormalities. So we want to thank you again for watching this demo, and in the next section, we'll cover the wrist and hand exam. Stay tuned.
The last part of the upper limb evaluation is going to be the wrist and the hand. So we're going to look again with our eyes, any deformities, swelling on the wrists or the hands. We're going to look for good active range of motion, and if needed, we can do strength testing and palpate any areas that might be tender. What I usually like to do when I'm doing an exam is kind of start and do the entire upper limb exam with inspection, palpation at the same time, and then take them through the range of motions, starting from the shoulder, moving all the way down to the hands, and then doing the strengths if needed. All right, let's take a look at the wrist and hand demonstration.
Welcome back to the MSK and Marfan Check Station. In this demo, we'll review how to assess the wrist and hand, which is the last part of the upper limb exam. This is a critical part of the MSK exam and sports pre-participation physical. So first, like we've done with the other parts of the upper extremity, we're going to inspect the wrists and the hands for any deformity. Have you ever injured your wrists or your hands? No. Good. All right, so once we've done that, we're going to test the range of motion. So follow what I do. You're going to go up, good, down, and you're going to do ulnar deviation and radial deviation. Very good. Now you're going to spread your fingers out really big, close them, and close your wrist. Good. So we did all that. That was the active range of motion of your wrists and your hands. Then we're going to do some strength testing. So on this one, I want you to put your hands up like this. So I want you to push down for me. Push, push. Okay, and back up. Keep your elbows locked like that. So push up, push down. Good. Now grab my hands, squeeze as tight as you can, and now stick your fingers out, let go, and then you can let go, and put your fingers out like that. And I'm going to try to squeeze them together. Don't let me do it. Keep them spread. Good. Good. Okay, great. So now that we checked all of that, throughout the process, we palpate a little bit, make sure there's no tenderness or discomfort, okay? So that essentially concludes the wrist and hand exam. We've observed, we've had them move through some range of motion, tested strength, and we've palpated for any abnormalities. So thank you again for watching this demo. That's the last section of the upper limb, and next we'll move on to the lower limb exam.
All right, moving on to the lower extremity exam. We're going to start at the hips. Now, generally speaking, if we were in the clinic and we were going to do a comprehensive lower limb exam, we would have the patient lay down on a bed. But obviously, we're trying to be efficient in these sports PPEs, and we usually have young, healthy athletes without a lot of issues with mobility or injuries. Now, of course, if the student athlete has a history of injury to any joint, we need to pay particular attention to that joint, and we might have to modify the way that we examine it. But for the most part, we're going to do a gross assessment of the physical exam of the lower limb. You'll notice that for the lower limb strength and palpation, we usually save the strength portion for the multi-joint assessment area, which I'll show you a little later. And we don't generally palpate unless they report pain or discomfort. So looking at the hip, we want to look for any deformities that we can see. We want to make sure that the hips are level on both sides. We'll have them run through a few active range of motion, and then we'll move on. So let's look at a demo of the hip.
Welcome to the MSK and Marfan Check Station. In this demo, we'll review how to assess the lower limb, starting with the hips. This is an essential part of the MSK exam for the sports pre-participation physical. All right, first we're going to inspect the hips. We just kind of looking to make sure they're symmetrical on both sides. Next, we're going to move on to range of motion. So I'm going to ask the patient to follow what I'm doing. So we're going to do flexion of the hip, extension, abduction, adduction. Oh, I'm going to fall. And then external rotation and internal rotation. Now I'm going to repeat it on the other side. Okay, standing on this leg, flexion, extension, abduction, adduction, okay, external, internal rotation. We just did a little dance there, didn't we? Yeah, pretty much. So we had good range of motion. If they have trouble with the balance, it's also testing for balance here, but you can have them hang on to a bed or a locker just to make sure that they don't fall over, okay? After that, generally in a normal physical exam, we would assess for strength and also do palpation, but in this assessment, we'll wait and do those exams in a different part of the exam. Okay, so that concludes the hip exam for now. We'll observe. We had to move through some range of motion. Later on, we'll do the strength testing when we do the crab and duck walk. So thanks for watching, and the next section will cover the knee.
All right, moving on to the knee. A lot of athletes have trouble with knees, so we might have to pay a little closer attention to this. We'll want to observe the knees, inspect and compare the right to the left knee, looking for any swelling, redness, deformity. We'll also take them through a quick range of motion while they're standing. And again, we will assess for strength later on when we have them do the duck walk and the crab walk. Let's look at a quick demo.
Welcome back to the MSK and Marfan Check Station. In this demo, we'll review how to assess the knees. This is an essential part of the MSK exam and the sports pre-participation physical. All right, first, again, like the other joints we've assessed, we're going to take a look. So we're just inspecting the knees, looking for any swelling or abnormality. We're also looking to make sure that they are symmetrical on both sides. Next, we'll assess the range of motion. Generally, when we do the lower limb, like in a clinic, we would have the patient laying down to do these assessments. But since we're trying to have this move efficiently, we'll have them do it while standing. So I'll have you flex the knee as much as you can and extend the knee. Very good. Same thing on this side. Flex and extend. Very good. Basically, only two range of motions in the knee. That's pretty much it. Everything else, strength and palpation, we'll do later on in a different exam, okay? So that concludes the knee exam. We observed just the general range of motion. We inspected the joint, and later we'll test the strength with the crab and duck walk. So thanks for watching this demo, and in the next section we'll cover the ankle exam and the lower leg.
Moving down to the leg and ankle. Now we know that the ankle is a particularly prone area to getting injured because of the flexibility we have in this joint. So definitely want to ask if any history of injury to the ankle. We'll inspect, looking for any swelling or differences from right to left. We can take them through really quick, gross, active range of motion on this. And again, we'll cover the strength later on. Let's look at a demo.
All right, welcome back. In this demo, we'll review how to assess the legs and ankles. So this is also an essential part of the MSK exam. First, we're going to inspect the ankles. Most of the time at this station, the athletes already have placed their shoes back on and their socks, so it's okay to assess this way unless you suspect any injury or abnormality. So taking a look at the ankles and the feet, everything looks symmetrical, that they are standing well on both feet. Next, we're going to assess the range of motion, just a gross assessment. So what I'll have the patient do is just step up on their tippy toes, okay? And then step back down on their heels, pull their heels up a little bit. That essentially checks the range of motion. The other thing you'll have a patient do is go to the side and then inside. Good, checking for eversion and inversion, eversion. Good, so he has good range of motion there. And that's pretty much it. Again, we'll test the strength later in the crab and duck walk. So that concludes the ankle and the leg exam. We had the patient move through some gentle range of motion, and we observed the ankle and leg area. So thank you for watching this demo, and in the next station, we'll look at the feet.
All right, lastly for the lower limb exam is the foot. Now, most of the time at this station, at this point in the exam, the student athlete does have their socks and shoes on. So if in the history portion you talk to them or they're reporting pain, we do need to ask them to remove their socks and shoes so we can look at their foot better and see if there's actually any deformity or swelling. Otherwise, there really isn't too much to this component. If they're able to walk, they're able to do the multi-joint assessment tests, they should be good to go. So let's look at a quick demo.
Welcome back to the MSK and Marfan's check station. In this demo, we'll show you how to assess the feet, which is the last portion of the lower leg exam before the multi-joint assessment. In this exam, this is an important essential part of the MSK exam and the sports pre-participation physical. So like with the other joints, the first thing we do is look for inspection. Now, I just generally inspect the feet without the socks and shoes off. If you suspect any abnormality, you should have the athlete remove their socks and shoes. Next, you would do the range of motion. You can't really assess it very well, but essentially you're going to have the athlete kind of scrunch their toes up. You scrunch them good, and then straighten them out really well. Okay. If I had any suspicion of an abnormality, I would have the athlete take their socks and shoes off and examine it better that way. That's pretty much it for this. Okay, the range of motion, there's not much to assess with the foot. Later on, we'll do the strength testing, which comes with the crab and duck walk like we mentioned before. So thanks for watching this demo, and in the next section, we'll cover the multi-joint assessment. Stay tuned.
All right, now for the multi-joint assessment. There are basically two different techniques to doing the multi-joint assessment. Sometimes we do one, sometimes we do both, or a combination of the two. So the first one is called the duck walk. Essentially, we will either demonstrate or explain to the student athletes that we'll have them squat down as far down as they can go, and then they will walk on their tiptoes forward and backward to assess for lower limb strength, coordination, balance, and look for any abnormalities or asymmetry. Most young student athletes are able to do this. If they are uncoordinated or not able to, you want to definitely make sure that it's because they're just uncoordinated, not because there's any abnormality of their lower limb. All right, the next one that we have for multi-joint assessment is called the crab walk. So the purpose of this is to evaluate both the upper and the lower limb. We're also looking for core stability here. So it's actually a really good assessment kind of to grossly look at the athlete's overall strength and well-being of their limbs. So basically we'll have the athlete come squat down and lean back on their hands, and they'll propel their body weight forward and backward, kind of crawling like a crab. And essentially we're assessing for their shoulder stability, arm, leg coordination, and their core strength. So let's look at a demo of both the duck walk and the crab walk.
Welcome back to the MSK and Marfan check station. In this demo, we'll review the multi-joint assessment, focusing on the duck walk and the crab walk. These assessments are essential for evaluating coordination, balance, and overall limb function in the sports pre-participation physical exam. So first we'll start with the duck walk. I'm going to instruct Eric to come down over here to this section right here in front of me. And I'm going to have him turn that way and squat down as far down as he can. And he's going to walk forward on his legs. So walk, walk, walk. That's the duck walk forward. I'll have him walk backwards. Good, good. Excellent. All right, stand up. So that's the duck walk. Basically, I'm assessing for any abnormalities, any difficulty in balance or coordination of performing that exam. Then we're going to do the crab walk. So I'm going to have the patient, again, go back down and then rest his body on his arms like a crab. Very good. And now I'm going to have him walk forward like a crab. Very good. All right, now backwards. Good. And I'm not quite so limber, but stand up for me. If you need to, you might have to demonstrate this for your athlete to know what you're asking for. So thank you very much. That concludes the multi-joint assessment, the duck walk, the crab walk. They're valuable tools for assessing the overall coordination, balance, and limb function of the athlete. Thanks for watching this demo, and in the next section, we'll cover the specific indicators of Marfan syndrome. Thanks, and stay tuned.
All right, the last portion of this section is the Marfan syndrome indicators. And this is specifically placed here so that you can document any findings, but you'll want to be cognizant of this throughout all of the stations, including their general appearance, when listening to the heart or the lungs, looking for pectus excavatum or carniatum. You'll want to kind of keep an eye out for this in every station, but we want to definitely make sure we do a few things here. So here are the different exams that can be done to rule in or out Marfan's. If you have a higher suspicion, say they're kind of a lanky, taller child, or they have a family history, you'll want to do more of these assessments. At the very baseline in this MSK station, we do 2 exams, the thumb sign and the wrist sign. And we'll show you a quick demonstration of these coming up here shortly. Again, you want to base how many of these you do on your level of suspicion. So let's look at what this kind of demo would look like.
Welcome back to the MSK and Marfan check station. In this demo, we'll review how to assess some of the indicators of Marfan syndrome. These assessments are crucial for identifying any potential signs of this connective tissue disorder. So first we'll perform the thumb sign. So what I'll have my athlete do is put his thumb on his palm and then close his hand. What we're looking for is that the thumb does not stick out on the other side of his pinky finger. Okay, we're going to look for that. When the thumb goes or protrudes beyond the edge of the hand, this can be an indicator of Marfan syndrome. Next, let's test the wrist sign. So what I'll have the patient do is hold one wrist up and encircle with his pinky and his thumb. Okay. We're assessing that they don't touch or overlap here. When the thumb and the finger overlap, this is another indicator of Marfan syndrome. Now, before we did all of this, we would have looked at the patient and noticed if they were excessively tall or lanky in appearance. That would also be kind of a red flag for Marfan syndrome. We also look for chest deformities. Usually I assess for this when I'm doing my cardio exam, but we're looking for a pectus excavatum or a pigeon chest. Okay, also called pectus carniatum. These are also common signs of Marfan syndrome. So if you're concerned after all those exams and you think that maybe the patient might have Marfan syndrome, you can also measure the patient's arm span. So you have the patient stick their arms out to the sides all the way. You would measure this arm span, and if it surpasses their height, then that is another indicator of Marfan syndrome. Okay, you can put your arms down. So those are the different exams you can do. Depending on my level of concern of the patient, I do change how many of those I do, but at very minimum, I do the thumb sign and the wrist sign. Okay, so that essentially concludes the assessment for Marfan syndrome and the indicators. These steps are very crucial to the sports pre-participation physical exam. In the next section, we'll do the overall exam demonstration for Station 3. Thanks.
All right, so looking at the Station 3 exam, we want to definitely be able to point out any common abnormal findings or red flags. So let's kind of go section by section, we'll look at these. So as far as the neck is concerned, there's not usually a whole lot of pathology in the neck, maybe some limited range of motion or history of injury. Now, if a student athlete has severe tenderness or limitation of range of motion, you definitely need to document this and let your faculty know. As far as the back is one where we do find scoliosis pretty often. So you have to be able to determine whether there's asymmetry. And the more normal backs you look at, the more you will be able to determine when you see an abnormal looking back. If they have any severe tenderness or significant deformity of the back, we want to let our faculty know, and we always want to document all our findings. For the upper extremities, again, we're looking for general range of motion. We're balancing right to left. Common things we might see are history of injuries, surgeries, a little bit of kind of muscle wasting if we had a recent injury. And then red flags would be severe joint instability or significant pain or weakness. Moving on to the lower extremity, again, kind of the same thing as the upper limb. If they're having a limp, trouble, or history, if they have severe tenderness or gait disturbances, they can't do the duck walk or the crab walk, those would be reasons why we need to let our faculty know. And last but not least, Marfan syndrome. Again, if you're suspecting it, if they look like the type that might have it, you need to be more vigilant with the examinations that you're doing. Here on the left hand side, we have a demonstration of an abnormal thumb sign. So you'll see that as the patient sticks their thumb out, you can see it sticking out of their fist, which is abnormal. And then on the bottom, you see that there's some overlap between the thumb and the pinky, indicating that they might have a positive wrist sign. Below that, we see two demonstrations of a pectus excavatum and a pectus carneatum. So these are just things you might want to keep an eye out for as you are doing these assessments. If you notice anyone that looks to be high risk for Marfan's, you need to let your faculty know as soon as possible. All right, so now that we've looked at all the different components to Station 3, let's take a look at a full demonstration from start to finish of what this station looks like in real time.
Welcome to Station 3. This is the MSK and Marfan check station. In this demo, we'll go through the entire examination process as you would do at a sports PPE event. This is what a complete station procedure should look like for each athlete. I usually do these in pairs, either 2, 3, or 4 athletes at a time for efficiency. So, hi, I'm Christina. I'll be the PA student taking care of y'all today. We're going to do a quick MSK exam. But before we start, have either of y'all ever had any problems with any injuries to your limbs or your back or neck? No, great. All right, so let's move on to the exam. Basically, you're going to do what I do here, okay? So for the neck, we're going to go back like this. Good. We're going to go forward to the front. We're going to go to the side and the other side. And then we're going to say no, big, big, big. Okay, good. Any pain when you do that? Good. No. Any pain? I'm just going to palpate your neck. Very good. All right, now we're going to move on to your back. So if y'all can bend forward all the way and touch your toes. Very good. Good. I'm just going to assess the back, looking for asymmetry on the back here. Just going to take a look, making sure it's nice and straight, which is great. All right, now let's do some other range of motions on your back. Let's go to the side like this, like you're picking up a suitcase. Other side. Good. Now let's do twisties. And other way, twisties. And then back to the back, like you're doing the limbo. Very good. All right, so we did all those range of motions. Any tenderness on your back at all? Any pain when you do those things? Okay, very good. All right, now let's move on to our upper limbs. We're going to start with our shoulders. We're going to go all the way up, all the way back, and to the side without hitting our friends. Good. To the middle. Good. And we're going to go football goal, and then down. Good. All right, so the other thing I'm going to do is test your strength. So out, back, forward, side, up, forward, and then the other way. So down. Good. Same thing here. Forward and back. Good. So I'll do the same thing on the athlete here. I'm not going to do that for the sake of time. Now we're going to do range of motion of our wrists, our elbows, up, back, and then here, pronate, supinate. Very good. Like this, at your elbows at your sides. Good. Very good. Like this and like that. Okay, good. Now push up, push down. Good. Turn in, not let go. Turn in, turn out. Good. Same thing here. Turn in, turn out. Good. And then up. We already did that one. Okay. Same thing I would do over there for her. Then we're going to do range of motion of the wrist. So up, down, side, side. Hands open and close. Good. So again, go up, down, close. Good. Spread them. Like this. Good. Other one. So up, down, close. Good. Spread them. Good. And then I do the same assessment there. So we've done all of that. Now we're going to move on to the lower limb. So we're going to go up, back, okay, side, don't kick me, inside, good, and then in, out, good. Same thing with the left. So up, back, in, out, and then side, forward. There you go. Good. All right. So that's good. Now we'll do the range of motion of the knee. So up and back, up and back. Good. And then we'll do the range of motion of the ankles, so up and down, and then a little rock on the heels. Good. We did all of that. Now we need to do let's see, the crab walk. Are we ready to do that? Or let's do the duck walk first. So I would line you up one and then the other. So Eric can be here, Ruby can be here. And then we're gonna have you do the duck walk going that way. So if you can bend down, squat down, and then walk as best you can. So walk, walk, walk. Good, good job. Okay, now backwards. Very good. And then have you do the crab walk, so get back on your hands in that same position. Now lean back on your hands. Good. Now do the crab walk going that way. Good. And then back. Very good. All right, stand up. We have one more thing to check, and that's for Marfan, so you can have a stand right over here, whichever way. All right, so on this one, I want you to open your hands, put your thumb in there, and close your hands. Good, so I'm just looking to make sure that the thumb's not sticking out. Good, and then I'll have you have one wrist and try to grab and close with your pinky. Okay, good, and neither of them close. So that concludes this demonstration. Do y'all have any questions? No. All right, then you can move on to the next station. Everything looked good. Thanks. All right, so next we'll move on to the hernia station for the males. Thanks.
All right, now let's wrap it up with the summary and key takeaways. In this section, we'll recap the main points. First of all, we need to prepare. We need to be ready to examine the patient, make sure that we have a proper setup in either the locker room or the gym, wherever we're performing these exams, making sure that we have enough PA students to supervise the exams, and then also that we have plenty of space for the student athletes to perform these exams. We also need to review any relevant medical history. Again, we're doing the MSK, including the upper limb, the lower limb, the neck and back, and the Marfan's check. Again, keeping your eyes out for red flags is crucial. It's not just about going through the motions. These are actual patients that require your crucial attention to detail. So make sure that if you don't know, if something looks a little bit suspicious, just have your faculty look at it with you. It doesn't hurt. But it can hurt if you don't say anything. So make sure that you brush up on those common red flags so that you're able to pick them out when they do come through on these PPE events. All right, so next up we'll have a post-test comprehension for the Station 3 area. And then moving on, the last Section 3 station will be Station 4, which is the genitalia and hernia check for the boys. And we'll do an overview of this, prep, and we'll show a demonstration of the station. So stay tuned for that. If you have any questions, again, reach out to us. We'll be happy to answer them for you, and we'll see you in the next station.